Good evening, guys. Okay, let's get me on my way home. Come ramble with me. Though this isn't really going to be a ramble. This is going to be a postpartum update. Well, I know it's been over 14 days because I upped my med. And I had to take the 25 milligrams of the sertraline for 14 days. Then if I wasn't feeling normal, double it to 50. And I've been, I don't know, 4 or 5 days now doubled, and I'm feeling a lot more normal. So I think that might be my dose. We'll see how I feel in a few more weeks, if I still feel good. So yeah, I think it's getting under control, which is nice, and I actually have evidence that it's getting under control. This past weekend, Princess had a mini meltdown, and I handled it the way I want myself to handle these things, with patience and calm and consistency. Sorry, I didn't turn the light on for you. So I didn't match her decibel for decibel with the screaming. I did not lose my cool. I was calm and patient and consistent, which is how I like to parent. She didn't like it, obviously. That's why she was screaming. She wanted her way, and she had been given opportunities to obey, and she was told what the consequence would be if she did not follow through. She did not follow through, so she had to suffer the consequence of missing her Saturday morning art session. And she kept begging and pleading, I'll do better one more time. And it's like, that wasn't the first recourse. That wasn't your first strike. Was not you lose your art class. It was the third or the fourth, I forget. But then I was like, okay, if you can't do this, it was to go to bed. If you can't go to bed and stay in bed, then you don't get to go to your art class in the morning. She didn't stay in bed, so she didn't go to art class Saturday morning. So hopefully, she's 9, she'll learn. When mommy says something, mommy means it. Mommy is honest and does not lie. Mommy says something's going to happen, it's going to happen. If everything, if all the criteria are met, mommy will follow through. So I followed through, and sometimes parenting is just hard. I don't want her to miss her art class, but she's got to go to bed too, and that was something that got her attention. So anyway, so yay me. That was nice to be, not that I had to punish her, but nice that I did it the way I want to do it, with patience and calm and consistency and, honesty. And, anyway. Another reason I know that it's working is because I didn't freak out last week. Zach is 11 weeks, and I have yet to have a period, but I should have had one last week based on my birth control pills. There was no period, so I was concerned that I might be pregnant, because apparently post-weight loss surgery, post-delivery weight loss surgery patients are a little more fertile than average public, for whatever reason, or at least that seems to be the issue, because I know lots of weight loss surgery people with Irish twins, or who are expecting the second of their Irish twin set. And so I was concerned, justifiably so, that we might be pregnant. So I tested. I didn't freak out. I didn't spaz out. I didn't have a meltdown. I just bought the test, took the test, it was negative, so we're just going to assume that because of the pill and because I'm nursing, I just didn't have a period so far. So, okay, whatever. I'm on my pills. We're on the pill and using backup protection. So, if we do end up pregnant, it's totally because God wants us to be, and, whatever. But we're not, so yay. I might get cut off. My battery's low, apparently. Another way that I know the medication is working, I don't know if I've mentioned this here, but Zach likes to, let me see if I can think. He likes to keep his head like this, but even more extreme. Like, I can't get my head in the position that he likes to keep his head in. So it's like this, but his chin is pointing up in the air, and his head is like, just seriously. If you're on my Facebook, you've seen a picture because I posted it asking for, advice, experience, whatever. And at that point, we were doing research, and I read about torticollis, and I messaged my doctor. She's on medical leave, and she said, just reposition. So that's what we've been doing. Stretching his neck, repositioning his head, lots of tummy time, and he's got great mobility. I mean, there's no mobility limitations. But this last week, kind of noticed that his face is now kind of crooked. And it's not serious. And if you're on my Facebook, I post pictures all the time, so you can go and look. And, I've asked people, it's like, can you tell? And even my husband, looking at him, he can tell. But looking at his pictures, he can't really tell. But it's his right side. The right side of his face is a little bit larger than the left side of his face. So maybe not that it's crooked, but it's not symmetrical. The right side, and it's more so since his cheeks have filled out. The right side cheek, it's puffier. Even up here on his temple, it's rounder. It's more flat over here, and he doesn't lay. I was like, well, maybe, because when I first noticed it, I was like, okay, so maybe that's the side that has all the pressure on it when he keeps his head that way. But it's not. The pressure is on this side of his head, and that's the side that's more rounded, which makes no sense, because the flat spot usually occurs on the side that they lay on all the time. So anyway, notice this Friday night or something. So, of course, everything I notice is on the weekends when you can't really do anything about it. So I put a picture up, messaged my doctor, because she's on my Facebook, and I was like, check out his picture and tell me what you think. We're not seeing her till August 11th, and she's not back at work yet from her surgery. She messaged me back, and she said, I'm not coming back when I thought I was, which makes me sad for her, because that means her recovery is not going as well as she had hoped. But she said, just keep repositioning. It's okay to just wait till you see me. She's like, or if you want, I'll have her nurse get me in with the peds office. So we go to the peds office tomorrow and get his crooked little head checked out. Anyway, have a good night, guys. Bye.